Hello, folks. This is Bob Phillips for Whatever It's Worth. Now, I'm not necessarily saying that anything I talk about is right or if I'm wrong on the subject, but let's take a look at a few things. Last night, I happened to be watching the CBS Evening News, and there was a gal on there. Her name was Dr. Rainey. She was from Rhode Island. And the question posed to her is, what's the situation with supplies? Her comment was, if I can remember this correctly, was that obviously she's running short on supplies like so many other hospitals around the United States, not only in the hotspot areas of New York or Washington, but all hospitals throughout all states seem to be running into this problem of masks, safety equipment, and ventilators. Her comment was that many of her orders are being diverted to New York, which is kind of interesting because Governor Cuomo has constantly been on the news about he needs for the state of New York. So I guess my question would be for Governor Cuomo, what did you do for preparedness for emergencies like this? Now, each state is independent to the best of my knowledge in our country. And each state always talks about the impedance of the federal government. When the federal government tries to impede on that state, they say, hey, wait a minute, this is our state. Stay the heck out. However, in times of desperate need, the states are going, hey, where the heck were you, federal government? So to me, that seems like a double-edged sword, or call it what you want, hypocritical. It doesn't matter. So again, for Governor Cuomo, what did you do to be prepared for emergencies like this pandemic that's going around? And you have been saying on the TV several times, hey, the rest of the country, you better look out. Here it comes. You can see what we're going through, so get prepared. Get prepared. Well, how can they get prepared if all their supplies are being sent to New York? I just don't get it. I honestly just don't get it. I'm confused. So I guess let's talk about this whole epidemic and pandemic scenario. Earlier today, I was on the CDC website, and I'm going to quote some numbers that were taken off of the website. You're welcome to go to the CDC website. You'll pull down the same information that I pulled down. How they collect these numbers, I don't know. How all the numbers that are being posted in the news today, I don't know. No one has ever stated that. I'm confident that communist Russia is not giving us their accurate numbers. I'm confident that the numbers coming out of refugee camps that total in the millions are not accurate. How many of those people die every day of starvation and other problems, let alone a virus like this? You would think that a virus like this would be running rampant through those places that have such terrible living conditions and such poor health care. But at any rate, from the CDC, I looked up for the 2018-2019 flu season. Now, I know everybody's comparing the regular flu is not the same as this COVID-19 flu, that this COVID-19 flu has this or that that's different. Okay, that may be the case, I'm not disputing that. Again, I'm not saying I'm right and I'm not saying I'm wrong. I'm just posing some questions out here for you to think about. The CD said in 2018-2019 that 35.5 million people got sick from the influenza, just the regular flu. 16.5 million people ended up going to seek health care. whether it be from their doctor or hospital, I don't know. I can tell you around here where I live, a lot of the locals treat the hospital emergency room as their primary care physician. Whatever happened to Obamacare, I don't know. And then they go on to say that 490,600 hospitalizations. That's a lot. We're talking close to 500,000. And there were 34,200 deaths from the influenza. 34,200, and that is for the 2018-2019 flu season. Now, there was also a swine flu, the H1N1 pandemic, it was called, of 2009. And it began in the United States and spread across the world very quickly. Again, the CDC quotes, and I'm going to read this just to make sure I don't misquote anything. They say that from April 12th, 2009 to April 10th, 2010, okay, a year, the CDC estimates that there were 60.8 million cases, 274,304 hospitalizations, and 12,469 deaths in the United States alone. Now, let's not forget, again, go check the CDC site. 1968, there was a pandemic with the H3N2 virus. In 1957 to 1958, it was a pandemic with the H2N2. 1918, there was another pandemic with the H1N1 virus. I remember early in the 70s when I was in the military, you had to take a swine flu shot, the H1N1. I remember it being advertised, to the best of my recollection, that people were dying from getting the vaccine. Whether that was true or not, I don't know. That was the rumor going around at the time. And everybody was looking at each other going, oh, we got to take that shot? Well, you're in the military. You don't have a choice. Go get it. So, I don't know what is causing such a stir in the United States right now about, or the world, about this flu, the COVID-19. Yes, people are getting sick. Yes, people are getting hospitalized. Yes, it's a terrible situation. Yes, people are dying. Yes, we're short on supplies. But this is not new. And if it's not new, let me go back to my part of my initial comment. If this is not new, Governor Cuomo, what did you do to prepare for this? Why is it the federal government's fault? Now, I'm not defending the federal government for not taking on more responsibility, getting things done, getting it done faster, but it's a political nightmare. It's always the Democrats against the Republicans. If it's a Republican president like we have now, the Democrats blast the poor guy, right, wrong, or indifferent, for just about everything you can think of. If it's a Democratic president, he gets blasted. It's Obama versus Trump. What happened during his administration? What happened during Trump's administration? You know what? I'm tired of hearing about it. How about we just fix the problem and everybody quit blaming everybody? So, at any rate, that's my opinion. I highly doubt I'll hear from Governor Cuomo, but if I do, that would be great. I'd be interested to see what the gentleman has to say. But for now, this is Bob Phillips. For whatever it's worth, that's my opinion. Have a great day.